Good evening, everyone. This is Joe Hage from Lit Conversations. We are very excited and happy to kick off this program with Everett Public Schools. And tonight's special guest is Rafka Hage. She is coming from the healthcare industry, specifically as a registered nurse. So Rafka, please take it over.
Hi, everyone. My name is Rafka. Thank you, Joe, for that introduction. And thank you all for having me Lit Conversations in Everett Public Schools. So to give a little background about myself, I am a registered nurse. I've been a nurse for over 3 years now. I went into it as a second degree. So I went to the University of Connecticut and I got a Bachelor's of Science in Allied Health Sciences, which is a major that some people might not be too familiar with. It's basically like a broad health science degree where you can kind of tailor the classes to what you might want to do after college. So kind of like a pre-med, but a little bit more focused to the classes that you would like to take. So when I graduated with that in 2016, I knew I wanted to go into healthcare, but wasn't sure exactly what field was best for me and what I wanted to get out of a career. So I took some extra classes. I did an EMT course during that time, retook some anatomy classes to help my GPA for postgraduate programs. I did some shadowing with different healthcare providers. I shadowed nurses, doctors, physician assistants, and I found through that nursing was the best career for what I wanted. I wanted a career where I can help people every day, where I'm learning something new on the job, and I wanted to be able to follow patients through their care, through their illnesses, diagnosis. So from the start to kind of helping them with their treatment, supporting their families as well, educating. And during that time, accelerated nursing programs were starting to become more popular or more well known. I applied to Northeastern University in Boston, and I did an accelerated Bachelor's of Science in Nursing. So it's a 16-month program and you get a Bachelor's of Science. So what people do in 4 years, we were doing it in 16 months. So it was definitely, difficult and very rewarding at the same time. After that program was done, I got a job at Beth Israel Deaconess Medical Center in Boston as well. I started on an inpatient surgical unit, so it was an adult hospital. And the specialties we saw were urology, so all kind of like urinary procedures. So kidney stones, we saw people that had kidney problems, prostate problems, surgical procedures like that. We did GYN, so a lot of women reproductive, and we did orthopedics, so knee replacements, hip replacements, and a lot more, specific orthopedic procedures. And it was a wonderful experience. I was there for about 1.5 years. And I gained a lot of nursing skills. I strengthened, my nursing assessment, learned how to prioritize, communicate, and you really know how to work as a team, where it wasn't just you and the patient, you had the families there, you had the doctors, physical therapists, occupational therapists. So it was a lot of learning how to work together, making sure the patient was our top priority at all times. After I worked there, I'd always wanted to do pediatrics, and I was offered the opportunity to work at Boston Children's Hospital. Again, I was on an inpatient surgical unit, and instead of adults, I was working with children now, and it was very, very wonderful experience, very rewarding. And we treated the same specialties that I had originally started in, and we did more. We did, we saw plastics, which was kind of like reconstructive surgery, ear, nose, and throat. So a lot more specialized surgical procedures were done there. And again, it was great going in, having the experience that I did, because I knew how to work as a team player. I knew how to communicate when there was issues going on with a patient that needed immediate attention. And I am from Connecticut. I'm sorry, I don't know if I mentioned that earlier. And, you know, after I was at Children for a little bit, things had come up and I wanted to move back home. So when I moved back in the end of the summer, I started working in an operating room through Yale, New Haven. And that's been great, especially with the experience that I had, because the procedures that I'm seeing in the operating room, I had those patients that I was caring for them after. So it was kind of like this big full circle. It was great to know how to care for them after, but now it was also so cool to be able to see what happens before surgery and in the middle of surgery. So I'm learning a ton of new skills that have been wonderful. It's been a great opportunity, and healthcare has changed so much since I just started with the COVID pandemic and learning how to kind of switch up and learn very quickly on the job. But overall, it's been a wonderful experience.
Like for high school students and students who just graduated from high school, do you recommend doing kind of patient care industry certificates, certified nursing assistant certificates, medical assistants, so that they can start experiencing kind of what it is working in healthcare? Do you recommend those industry certificates? Are they in high demand?
Absolutely. Yes. I think that is a great opportunity to start when you kind of have an idea that that is what you want to do. If healthcare is something that you want to go in, whether it be nursing, whether it be to go to med school, to become a physician assistant, nurse practitioner, it's great to kind of get your feet wet, get those opportunities in when you can. And that's what makes you a better provider later on. And it also helps you make sure that, yes, this is what I want to do. Of course, when you start off, as a CNA, nursing assistant, and LPN, it's the roles and responsibilities are different for you, but you have a wonderful idea of working as a team player, making sure your patients are safe, keeping your patient at the center of all your care. So if you have an opportunity and you want to learn more, the best way to do it is to definitely get into the field. I definitely recommend it, and I think it would be great for anyone to do.
Thank you.
I have a question. So the path to being an RN is difficult, but why, number one, is the particular industry so competitive given the amount of need, and why is there a shortage, unless the shortage is because it's competitive?
Great question. So for the shortage, a lot has happened over the last couple years, and a lot of the shortage that is being seen now is coming from burnout. Unfortunately, with the COVID-19 pandemic, there's been a lot of supply shortages, and patients are more sicker, and there's just a high demand that they're asking from. We're going to talk, because I'm a nurse, I can speak on, the nursing profession. There's a higher demand from nurses on what to do on a day-to-day basis. And a lot of those nurses, unfortunately, they're not given the right resources or the best resources in order to make their job easier, not to say easier, but to do their job well, and to be able to not put all that stress on them. And that's where a lot of the shortage is coming now. It's the burnout and not in the hospitals not having all the resources, not because they don't want to supply those resources, but it's just been difficult to get and to have. And as far as competitiveness, it's one of those fields where they want the best there. They want the people that are dedicated to the profession, that are going to be dedicated to their patients, that are going to go in and they're going to give their best to their patients. You know, this isn't a career or a profession where if you're like, oh, I want to work 3 days a week in a hospital and that's it. They are 3 very demanding days. You are there from morning to night or night to morning if you're working the overnights. And a lot of the hospitals in the Boston area do a rotating days and night rotation. So every 2 weeks, every 2-3 weeks, you're switching your schedule. So if that's not something that you are able to kind of adjust your life to, it makes it very difficult. So you do end up making a lot of sacrifices, but it's something that you want, and it's a wonderful, rewarding career that I think a lot of people, they don't really educate you well on that when you're in a program until you're in the real world working and realize what really comes with everything.
I have a question from a student. What tell us about the impact that COVID has had on your profession?
So it's been a difficult but rewarding experience as well. And it's crazy to kind of say rewarding and a pandemic in the same sentence, but it's been difficult because as going in as a surgical nurse, I'm used to my surgical patients. You know, we have a checklist that we're making sure our patients are meeting post-operatively, so after surgery. And then when the COVID-19 pandemic came, they expected us to be able to start caring for these patients where people didn't know much about COVID. Everything was changing every day. We would go into work one day, the next day we'd come in and they'd say, oh no, we have to do something else. It's coming from, you know, the CDC. So we had to learn how to care for sicker patients than we were used to. And it changed kind of my career in that way, made it difficult, but it also was rewarding because during that time, during COVID, families weren't allowed to be at the hospitals with patients. So it was just you and the patient, and a lot of them were, you know, very sick and at their last moments of life. And it was just you there holding the iPad while they're FaceTiming their family. So it was so rewarding to be able to make a difference in that patient's life and to spend the holidays with them when they weren't able to spend it at home with their families. So it was a big sacrifice, but it was definitely a period of my life that I will never forget.
Jeez, yeah, it's super difficult. Another question there. I gather these from the day. When I don't have great grades. I was told I could do nursing in community college. Can I still become a nurse?
Absolutely. Absolutely. I actually took some courses out of community college as well when I took my year off and redid some classes. So don't let that discourage you. You know, at the end, the NCLEX is a very big exam that nurses have to take before you can get your license and start working. Don't let the grades that you have right now discourage you from becoming a nurse. Definitely keep trying, take those classes. I did a lot of studying on my own. You know, I Googled a lot of things that I didn't know and bought my own like health textbooks that I was just reading up for fun. But don't be discouraged. If you have a dream to be a nurse or work in the healthcare field, I cannot recommend it enough. I encourage you to keep going.
I have like two more from kids. How much vacation time do nurses get?
Oh man, you know, that's where dependent on the facility that you work at. So you can have a lot of vacation, or they give you certain amount of times of the year you can take vacations.
The last I just got to the next question is, what is a traveling nurse?
Great question. So traveling nursing is when you work for a outside company. You don't work for a specific hospital. You work for a company that hires nurses, and they find you what they call assignments. So they're usually contracts about 12 to 16 weeks, depending on the company that you go with. And you can kind of choose the specialty that you want to work in. So medical surgical is kind of like the most common nursing unit, where you see everything, all surgical patients. You see what they call medicine patients. So what that means is like patients that have diabetes, or patients that come in with any sort of problem. They would put them on a medicine floor. And so you would be a what they call a med surg nurse. So you would get an assignment at a hospital anywhere. You can travel anywhere in the country. And you would go to a specific hospital. You would work there for the 12 weeks. Then you would take another assignment. You could take it in another state and do another 12-week contract. So it's basically like little 12 to 16-week contracts that you can take them in the specialty that you work in and in any state that you want.
Does a traveling nurse pay more?
They do pay more for travel.
Why?
That's a good question. We asked that. I don't really have a good answer for that, but because you're really filling the gaps in hospitals so they'll hire travel nurses to kind of fill their staffing ratios where they don't have enough nurses. So you're in such high demand that these hospitals are willing to pay you double what it is that you would if you were a staff nurse somewhere to come work for them, because they're that desperate for nurses.
So the last question I got from a student is private nursing, how do you get into private nursing? I didn't even know that was a thing.
Oh, good question. So I'm assuming that's kind of like concierge nursing. I'm assuming. I don't know if I'm interpreting private nursing correctly.
I guess having your own business, like having your own center or something like that, is what she said to me.
I don't know too much information on that. Sorry, I don't have a good answer.
Mm-hmm. It's okay.
Yeah, I lack the business side of things.
Oh, don't worry about that. So do I.
Those are all great questions, though.
Yeah, I've been collecting them.
Awesome.
All day. Collecting them all day. So I've never heard of how do you break into how do you go from being an intern? Actually, does being an intern in a nursing intern or hospital intern, does that really like give you a great experience into becoming a nurse, or does it help you?
Yeah, so being, for example, like a nursing assistant, kind of going in like that.
Yes.
Yeah, so it helps you for sure, because you're learning kind of the most basic skills. Like, for example, taking vital signs, which seems so little, but it's one of the most crucial things that you would want in a patient, and that kind of dictates a lot of what happens in the care. So you learn the vital signs, you learn how to talk to patients, how to communicate, which is such an important skill, because it's not like we're just kind of talking with each other. You kind of experience trauma, you experience like sadness, you go with the emotions of kind of what's happening, and you learn to be able to separate that from, you just kind of learn to control your emotions in certain situations, and you learn how to be a team player, which is one of the most important things about being in healthcare, is remembering that we are all on the same team for the patient. And knowing when you need to kind of relay certain information to the nurse right away, or what things, again, we don't expect a CNA to know kind of the most important, or what to look for exactly in a patient. That's definitely a nursing assessment, but you learn the basic skills, and you learn how to oh my God, I'm sorry, I lost my train of thought. You learn how to work with other providers, and that is really important. And it does help you when you're a nurse or in the healthcare field.
Thank you. My 17-year-old self would like to know, how did you learn to deal with the gore and the blood?
Oh, that's something you just kind of have to expect, and you just have to, you either can do it.
Terrified of needles. So I'm so to even like see my own blood, much less somebody else's, like.
Yeah, it's one of those things, you either can deal with it or you can't. And if you can't, then it's hard.
I've had quite a few nurses not find my vein. So I've been poked around a few times. And so I'm just wondering, like, how do you really prepare, especially with the trauma, like how is there a way in nursing school that they really prepare you for it?
No, that's actually where a lot of people find out that they can't do it, is when they're in nursing school and we're in clinicals, and they, I've had some friends that have passed out in the middle of certain things, and they're like, oh man, I can't do it. But that's not to say there's not a specialty that you can't do. So for example, a lot of people that can't handle things like that go into dermatology, or primary care, where you're not really around needles or blood or really traumatic situations. But it is tough, because you do have to go through it in the nursing school process. So it's one of those things, you can either get through it or unfortunately you can't.
That's make a break right there. That's
Yeah.
that oof, my gosh. So what is the next step after being an RN? Is there another step? Is there
Yeah, so you can either, to be an RN, you can either have an associate's degree, or you can have a bachelor's of science in nursing, which a lot of employers are looking for nurses to have a bachelor's of science. And after that, nurses can go and get their master's. And after that, so you can become a nurse practitioner. So you'd get like a master's of science in nursing. You can become a clinical nurse specialist. So you can specialize in certain things, like you can become a clinical nurse specialist in psych, and work with psychiatric patients. There's a ton of different routes after you become an RN, which makes nursing such a great field, is because you don't have to just stop there. You can continue. You can even get a doctorate in nursing. You can get a PhD. You can get into the business side, into the healthcare administration. You can now do telehealth, which is the newest, the biggest thing now because of COVID. So there's definitely so many different routes. You don't just have to work at a hospital as a nurse. And that's kind of a misconception that I think is taught right away, that in order to be a successful nurse, you have to work on a med-surg unit. And that's not the case. You can gain great experience working in any specialty that you go in, and you can kind of make your career the way you want it to be. So there's a ton of great routes that nurses can take.
Got a text message, and it says, what is the absolute hardest part of her job?
The hardest part of my job, I think, would be dealing with death of a patient. That's been something that no one can really teach you. No one can get you ready for that. And I hate to bring up a topic that's so, a very difficult topic, but it's one of those things that, again, they don't really teach you when you're in nursing school. They can't prep you for that. It's just unfortunately something that happens when you're on the job. And it's so important to have good support, to have support from your colleagues, have support at home to be able to help you process your emotions through that. You're allowed to feel how you do in a situation like that. It's never easy. And, you know, everyone deserves to be able to talk it out with someone.
Mm. What do you do for your mental health?
So personally, I like to work out. I like to go to the gym, and ever since I started this new job, I've always gone to the gym, but I never made time for myself, and that was a big mistake that I learned along the way. Is no matter what, you always want to make time for your mental health, because without it, you're not going to be able to go into work with a clear mind. You're not going to be able to give your patients what you want to give. And for me, it's going to the gym every day after work. I make it a priority to go get an hour workout in, and that really is helpful. And I have such a supportive family and friends that I can talk to them, and they're around. And always do something for yourself.
That's great advice. Sorry, I had a million questions.
No, I love it. Please keep them coming.
What's your favorite medical show?
Oh my God. I'm not really big on the Grey's Anatomy. I don't follow that. No, I know. Am I really in the medical field?
I really only like Grey's Anatomy for the music in the end.
I never got into it. I never did.
So you don't have a favorite medical show?
No.
ER show? No,
because I'll probably be picking out, oh, that's not right. They can't be doing that.
Yeah, you're right.
I'm right. One of those.
You're absolutely right. At what point, what age do you remember that you wanted to pursue becoming a nurse? Did you always know from like when you were a kid? Like I actually never knew if I was going to end up in education. I'm lying, but how about you?
Yeah, I was about 9 years old when I said I wanted to go into the medical profession. Yes.
Oh, geez.
Yeah, I know.
Do you guys get so how do we get more young people involved at an earlier age and keep them interested? I think like sometimes although we have our programs, they're great, but like I think a huge barrier is like an entry point. Like
I would like to see more resources available to younger people. I know some programs are like have to be 18 or over to do a CNA, or I don't know the exact age, don't quote me on that, but I wish hospitals did more, like after school programs, or where kids can kind of go and shadow or getting them into volunteering at hospitals, and kind of being around that environment kind of gets you prepped a little bit for kind of what to expect. I know it's different, but or just being able, schools providing, like what we're doing right now. I think it would have been great for me, even if I hadn't known that. I think it would have been great if my schools had offered, talks with different professions, and being able to ask them questions, or resources that they provided that can help kids learn more about it, or not be afraid to ask questions, and have that ability to access someone in a field that they want. I'm more than happy to, give my email if anyone wants to reach out with any questions that they have. I'm always willing and would love to help in any way I can for someone who wants to learn more and go into a profession like this.
You hear that, Miss Sanchez Serrano? So Abby, if you could unmute Abby. Abby has a question.
Sure.
Hi. I just wanted to ask, I'm a sophomore in high school. I want to be a pediatric surgeon. What would be like the best step like after high school to like pursue, like get into the medical field?
Oh, that's awesome. So my biggest advice would be to shadow people in that specialty. So if you want to do pediatric surgery, see if you're able to, you know, work on a pediatric surgical floor, or see if you can get in touch with a hospital and see if they have shadowing with a doctor there. And definitely get yourself out there and learn more about the field, and kind of learn what a day-to-day like is with a surgeon, and just kind of know what the job entails. So definitely do a lot of research, and that would be, or see if you can get into a hospital. That would be my biggest advice.
Thank you.
Of course.
Okay. I always ask this question, especially I try to save it for the last question, unless anybody else has any more. What is some advice that you would give your 15-year-old self?
I would tell myself that it's okay if the plan that you had for yourself didn't work out the way you always thought it would be. Because some things you are always like, I'm going to do this no matter what. And then, you know, life comes at you. There are a couple obstacles, and sometimes you end up in a different direction. And, you know, I didn't think I would end up in a nursing program after college. And it was one of the best things that ever happened to me. So always keep an open mind. That's what I would tell myself. Keep an open mind, and don't be discouraged, or don't be upset if a plan that you had thought was going to be the best plan for yourself, you end up doing something different, because sometimes those things end up being some of the best things in life.
Thank you.
Thank you.
Any other questions you guys have?
I'm good. This is great. Tremendous. I think I want to thank you for joining us. You know, it's, well, you're educators, like you're like telling, it's almost like some parts of education, like you're like a car salesman. Right? So you're like, all right, listen, this is gonna happen. This thing's gonna drive really well. You know, when you get to certain miles, it may not stop. Actually, they don't even say that. They just say get in the car and drive. It's gonna be good. But you know, we just don't